Hello friends, this is Dr. Saurabh Jaiswal, consultant dermatologist from Nagpur. So on behalf of DermaVidya.com, here I am to introduce you to the topic, very hot topic in dermatology, which is atopic dermatitis. So atopic dermatitis is a very common condition in children. So we'll be focusing on most of the preventive aspects and treatment aspects today. Atopic dermatitis is nothing but combination of dry skin with allergy. So allergies we can consider as trigger factors like house dust mites and many other pollen grains, etc. And where we can talk about dry skin, yes, dry skin is preventable, while on the other side allergy should be treated. So importantly, this atopic dermatitis is a clinical diagnosis. So we have to identify them with itchy and erythematous plaques, and we should identify these as a very important psychologically impacting condition which affects day-to-day life of children, which affects day-to-day chores from the parents, and it can definitely affect entire family, and they can seek multiple advices from many social medias, friends, families. But when they meet to a doctor or dermatologist, we should guide them at the most important aspect, which is prevention. So how to prevent dry skin? We can ask them to limit the bathing period. We'll start with the bathing first. So limit the bathing time where a baby should not shower or have bathtub bathing. Instead, they should use a 5 minutes bucketful water for bathing. They should use a very gentle soap, which they should use a very low pH or neutral pH soaps for the bathing purpose. After that, just after the bathing, they should use a good amount, ample amount of moisturizer, which should consist of ceramides, and it should cover entire body, not only the plaques but entire body. After that, we should also talk about the common sources of dust, house dust mites or pollen grains. So whenever we are talking about dust, ask them to regularly cleanse or change or wash the sofa covers, bed sheets, where the house dust mites are commonly located. We can also ask them to decrease the known pollen grains contact if they already know about it. They can also decrease the triggers which are known to them, and use ample amount of moisturizer at the bedtime as well. Now coming to the treatment part, first of all, the treatment generally includes topical mild steroids. So such treatment should be given by the doctor dermatologist only, or whenever we are coming for the follow-ups regularly, we should try not to stop the treatment whenever the next follow-up is due. Basically, whenever we are stopping the treatments in between, that is the reason for the next flare because of the rebound of the disease, and that's why most of the treatments fail. Whenever we are giving such topical steroids, tapering is the most important factor. So if the topical steroid is not tapered off completely or properly, like whenever we are using it twice daily and then make it once in a day and then slowly taper down. So when we are giving topical steroids, we should taper it down slowly. Like when we are giving it twice daily, then we can make it once daily. And after that, we can also introduce the steroid sparing agent like tacrolimus, nowadays tofacitinib, and many other steroid sparing agents are available in our kitty. When we are tapering down steroids completely, at that time we can increase the frequencies of such steroid sparing agents and then slowly taper them off as well. The most important aspect here, do not stop at all moisturizers, which will be continued for years together. And with that, I'll conclude this short take on atopic dermatitis. I would definitely ask all of my patients not to self-medicate. It's an important aspect in atopic dermatitis where patient may get overconfident about the treatment parts and may self-medicate about the steroidal creams because they know partly about this, and that may trigger the next flare of the atopic dermatitis. So I'll ask everyone, all of my friends, to enroll for DermaVidya.com, and happy learning.
For more such videos, visit or log into dermavidya.com.